Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Sabrina Huda binti Nur Hafizanlah. My metric number is 0526 and 38. So today I would like to present about my research proposal, which is an analysis of awareness level about COVID-19, knowledge, preventative technique among civilians. Introduction. In general, we can see the sensitivity of respondents on the awareness and attitude concerning infectious disease. Novel coronavirus, also known as COVID-19, is a new form of the virus that can infect people. Although bats are considered natural hosts of these viruses, various other animal species, including camel and civet cats, are also known to be a source. After that, COVID-19 was discovered in China, which caused hundreds of deaths. The present COVID-19 epidemic has resulted in a large number of reported cases all across the world. COVID-19 virus transmission is person to person and is comparable to seasonal influenza in that it can induce the same symptoms. At first, there is currently no vaccine or specialized therapy for this virus. And because it is a new virus, there is no pre-existing immunity, which means that the entire human population is potentially susceptible to COVID-19 infection. COVID-19 incubation time is expected to be between 2 until 14 days. Fever, cough, difficulty breathing, muscle soreness, and weariness are the symptoms. Elderly people and those suffering from health conditions such as diabetes, chronic respiratory illness, and cancer are at a higher risk of experiencing severe symptoms. Children's disease looks to be uncommon and mild. Due to no specific treatment for this disease, healthcare providers address patients' clinical symptoms such as fever and difficulties breathing. Supportive care such as hydration management and oxygen therapy can be extremely beneficial for patients suffering from the symptoms. The problem statement can be formulated as follows. Does Malaysian knowledge and awareness level being adequate about coronavirus? And does having knowledge and stimulate towards prevention measure against disease? Having advanced technology nowadays helps people to get information easier. However, sometimes there are several of them who did not care about important information, such as the cases of COVID-19. Such information is actually can help them to reduce the cases. So this study is about to research does Malaysians' knowledge and awareness being adequate about coronavirus disease that would stimulate towards prevention measure against the disease. Due to pandemic, there is a lot of policy that government needs to change, and the changes could affect civilians. For instance, limitation of travelers from going overseas, and it is obligatory for everyone to wear a mask to prevent the transmission of disease. On the other hand, coronavirus would lead to changes in socio or economic variables such as lifestyle. In research objective is the purpose of the study is to identify the level of awareness among Malaysians to stimulate the practice of preventive measure. And the second one is to identify the level of knowledge among Malaysians to stimulate the practice of preventive measure. Literature review. In the next slide, I will talk about literature review, which is from Priya and Shirkane's study. They provide a comprehensive picture of awareness in reaction to the COVID-19 epidemic. Several investigations on the epidemiology, cases, clinical manifestation, and identification, prevention, and control of the new coronavirus have been published during this critical period. However, research in the awareness domain, particularly among frontline workers, aid in mitigating the impact of the outbreak. The study participants' basic knowledge of COVID-19 was commendable, with only a few minor misconceptions observed. They conclude that there is a need to better understanding epidemiology, transmission, treatment and control, and prevention technique by increasing all communication channels. The study proposes that frequent webinars for educational intervention be considered since they could be a valuable and safe technique for raising awareness. Next, in Laban's study, shows that there is a scarcity of research on serious awareness and attitude concerning infectious disease. The majority of participants had a general understanding of COVID-19. The only significant characteristic that increased awareness were age, education, degree of education, and occupation. In this research, those aged 35 until 30 years, college graduates, medical professionals, and those earning more than 300,000 Syrian pounds had a high level of understanding and awareness of COVID-19, whereas respondents with a little income and education demonstrate the contrary. In Hamza's study, extraordinary measures have been taken to slow the spread of the continuing COVID-19 epidemic in Egypt. People's adherence to disease control methods is influenced by their knowledge, attitude, and behaviors. In this study, they investigated pharmacy senior students' knowledge, attitude, and practices about the COVID-19 pandemic. These findings suggest that dread exists in the population's awareness of an attitude towards infectious disease. This aspect may hinder future efforts to stop the virus transmissions. As a result, understanding COVID-19 public awareness at this vital point is vital for pandemic management. On the other hand, because of the increased usage of the internet and social media in today's linked society, fake news and rumor mongering are frequent. A model understanding of a growing infectious disease about which even experts have insufficient knowledge can lead to dread and turmoil, even undue panic, which has the potential to exacerbate the disease outbreak. For example, during the SARS pandemic, which lasts from 2002 to 2004, there were several misconceptions about SARS, leading to widespread panic. As a result, they were resistive to complying with advised preventive measures, such as avoiding public transportation, visiting a hospital when sick, and so on. This aided the quick spread of SARS, resulting in a more dangerous epidemic situation. Because it is a novel coronavirus, its epidemiological characteristics are unknown, and new studies and publications will last from a month to a year, making it important for all civilians to understand the level of knowledge and preparedness in managing patients infected with the virus.
Theoretical framework and hypothesis.
A theoretical structure has been created and formalized. The issues are discussed in this research, and two factors, which are awareness level and knowledge about COVID-19, that stimulate the practices of the preventative measure to the Malaysians. The picture depicts the relationship between these variables. Next, alternative hypotheses are used to express a relationship between a dependent variable and an independent variable.
Research methodology. This is the part of research methodology. The first one is definition of COVID-19. The second one is sampling design. The third one is types and sources data collection method, fieldwork plan, and data analysis and finding.
Coronavirus disease is a disease caused by novel coronavirus currently known as severe acute respiratory syndrome coronavirus 2, which was discovered after an outbreak of respiratory sickness cases in Wuhan City, Hubei Province, China. Formalized paraphrase, it was first reported to World Health Organization on December 31st, 2019. It was then a few months. The transmission of this disease has spread all over the world, including Malaysia. Due to COVID-19, many constraints must be overcome, such as limitation activities outside the home, and people need to further improve the level of healthcare in order to reduce the cases of COVID-19. The selection strategies utilized in this study are simple random sampling, which means that each element in the population has an equal chance of being selected or a known probability of being selected. The sample is called representative because the features of a correctly chosen sample accurately represent the parent population in all ways. This study relies on primary data sources, which the source that present first-hand information. The data sources can come from direct outcomes of an event they experience through the distribution of questionnaires, is referred to as primary data, which is Google Forms. Next is data collection method. Questionnaires have been used in this research as a data collection method. The structured questionnaire is one of the popular methods of collecting research data. This is one of the effective data collection methods because in Wright 2017 study, researchers from a variety of fields can find the internet to be a useful resource for creating a questionnaire. As the cost of computer hardware and software continues to fall and the internet's popularity grows, more segments of society are using it for communication and knowledge. Thousands of groups and organizations have gone online, with many actively promoting their presence through search engines, emails, and banner advertisement. These organizations not only provide information to use but also provide resources for researchers to gain access to a range of communities that are associated with these organizations. This study structures questionnaire, which is also known as a nil-type questionnaire. It is prepared by offering full response choices so that fillers or respondents do not need to write answer in their own words. Respondents only have cross answers to questions that have already been answered. On the other hand, the response will be more accurate since there is no influence gesture, facial expression or instruction, or respondent will answer the question at their leisure. Alternative response in the form of a like scale, such as yes or no. In fieldwork plan, this questionnaire aims to identify the knowledge and awareness level of COVID-19 disease among several Malaysians from various state and age. The questionnaires questions are short and concise in order to ensure that it does not take too much time to complete, which promotes participation. In questionnaire, there are two sections, which is the first section is used to collect demographic information about the respondents, such as range of age, gender, and state, while the second one is used to gather information in the aspect of sensitivity of COVID-19 and preventative technique. As we can see based on the table, a total of 100 respondents were sampled for the study. Most unmarried respondents, which is 75%, are from age 20 to 25, which is 35%, and more than half of the study population were women. The majority of participants with educational status, a diploma or higher, which is 53%. The second session questionnaire was designed to identify the respondents' awareness level and knowledge about COVID-19. As we can see on the chart, the viral cause of the disease was well known to the participant, which are 76%, and the results show that 70% of the participants agree the disease route of transmission through droplets from sneezing or shaking hands with an infected person. The majority of them had a sound knowledge about the symptoms of COVID-19, like shortness of breath, which is 99%, and low sense of taste, which is 93%, but not of the rest systems such as neurological symptoms. On the other hand, there were several respondents out there who did not sure about the cure of COVID-19 disease by using antibiotic, which is 33%. However, this matter was successfully resolved when most of them are aware and know that antibiotic cannot be cured by antibiotics, which is 67%. This is because antibiotics do not treat viruses but are only effective against bacterial infections. After that, most of them knew that the coronavirus can be destroyed by the extreme temperature, which is high temperature. Last but not least, most of the study participants were also well informed about the high-risk group, such as senior citizen 83%, cancer 95%, and chronic disease 87% for the coronavirus disease. However, they lack sound knowledge of the neonates and adolescents under the age of 5, which is 36% only. Last but not least, as we can see from the chart of preventive technique, with significant information and awareness about the coronavirus disease, the study discovered that many people were complaining with disease prevention measure, only with a small number of participants not taking precautions for optimal care during the outbreak. However, as a result, this is the function of the knowledgeable about the disease. By knowing and realizing the dangers of COVID-19 would lead civilians to be more careful. Wearing a face mask when leaving the house is the highest number of preventative technique, which is 68%. While the number of participants who avoid touching eyes, nose, and mouth was 49%, which is the lowest one among all the preventative techniques.
Last but not least, significance of research.
Significance of the research, the study will provide clear direction for all members of the public, especially those with high-risk populations. Due to difficulties in dealing with this epidemic, knowledge and awareness had played their roles in encouraging civilians to practice disease prevention. Although the risk of people being infected with this disease is high, by using prevention technique, this problem can likely be overcome, and it is not impossible if the number of cases in Malaysia will be zero. Thus, Malaysians' awareness and knowledge about COVID-19 is the focus of this study, since it may encourage civilians to practice preventative technique from the disease.